So, good evening to all of you. So, I will introduce today's speaker, Mr. KK Jain. He's a founder CEO at Zappy.care. He has 20 years of experience in the service industries, and today he will take us to digital hygiene among seniors. So, the stage is over to you, Mr. KK Jain.
Thank you so much, Bhayana sir. Thanks for giving us this opportunity. We can help you in maintaining dental hygiene, especially for our senior citizens out there, and would be interested to learn, address any kind of queries that you may have related to the topic or anything beyond the topic, if I may be able to address. Right. That's a brief about it. Can I present my screen? Great. So the topic which has been asked me to uh, deliberate upon is dental hygiene for seniors. While when I had the interaction with Bhayana sir, also he was also very curious to understand, because I don't come from a medical background. I come from a more of a services background, and how I would be able to do justice to this topic given to me, which is around dental hygiene for seniors, as one of the senior member already put across over while this discussion was started. In fact, I myself is suffering from some kind of dental problems for last couple of months and undergoing a treatment, right? So let's understand first and foremost why dental hygiene is very important, not just for seniors but across the age group around the society that we are representing, right? Healthy teeth, as you know, and the gums around you, it just not ensures that it gives you a lot of confidence, but it also ensures that your healthy teeth contributes to the overall physical as well as mental health of a human being is concerned, because that's where we consume any kind of uh, food, and unless you are able to extract the vitamins, minerals and proteins properly and chew it properly, your body will not be able to process or absorb the the true value of the food that you are consuming, right? So that's very fundamentally important. In addition to that, it also helps you to prevent diseases which are surrounding your gums. It helps you probably postpone or prevent the decay of your tooth to as much as possible, because today when you speak about, even at the age of 40, 35, 45, tooth decay has become very common, right? And that's because we are not taking care of our dental or oral hygiene the way it has to be taken care. And thanks to the eating habits and the changing lifestyle that we are undergoing, uh, it's more important in today's practical world to ensure that dental hygiene become a very ingredient part of our day-to-day life. In addition to tooth decay, as you all know, dental hygiene or oral hygiene also helps you that when you interact with someone very closely or proximity wise, it helps you to avoid or spread bad breath. In a way, it helps you to attract more and more people to effectively interact and communicate with you. If you take further, overall health, including heart disease and diabetes, are a subset of the dental in hygiene or hygiene that we are surrounded with. So, in case you want to postpone or reduce the impact of your heart related ailments, including the diabetes, the oral hygiene is paramount important. And last but not the least, it also ensures to maintain the quality of life by ensuring that when we speak, we are speaking very confidently and are able to exchange the pleasantry smile. So these are the few of the important 4 pointers which basically further reinforces the importance of having a regular and effective dental hygiene in our day-to-day life, not just because you are of 60 plus years or 40 plus years. It is important across the age group that you and me are representing today. Now, if I specifically focus around the senior fellow citizens out there, right? The common dental issues which are normally discovered across the seniors are there, which is basically called as we normally figure out a dry mouth, which medical language is called as xerostomia. Now, what is a dry mouth syndrome is that it basically reduces the saliva or your ability to generate saliva in your mouth. And when your ability to generate saliva reduces, it basically directly increases the chances of cavities and therefore gum diseases across our entire oral system. Additionally, it also increases gum disease, which is basically called as due to poor oral hygiene or certain medications. Because of the increasing age, there are certain other health issues which we are surrounded with. And the kind of medications we take, that also causes a lot of gum related issues. And since we are traveling the ages, right, there is a lot of wear and tear of the tooth, and therefore there is a decay and dentures which causes in our teeth as well. And the most important factor is that oral cancer, which is increasing as we speak about, right? And it's especially related to the age. And people who have got high habit of taking smoking and alcohol during their mid age and young age, the chances of acquiring oral cancer when you're 55 years and 60 years of age becomes exponentially very, very high. These are the common dental issues, not just surrounded with seniors in typical, but also we are discovering these kind of issues in middle-aged people as well. Now, here are certain tips typically which are called standard operating procedures, which are more important for all the seniors out there to take care of, right? We are being taught right from young age to ensure that we brush twice a day, right? And we should use not just any kind of a toothpaste, but use a toothpaste which has got good quality control of fluoride and soft bristle toothpaste, right? You need to floss at least once on a day, right? Wherein whatever is left over in between the teeth, right? And the plaque which is caused because of the food that we are eating, it gets removed because of the daily flock that we are doing. We have to use mouthwash as well, if not daily, at least alternate days, right? And most importantly, every 1.5 or 2 hours, we have to develop a practice of having water at a regular frequency to ensure that the decay in saliva generation at least is supplemented with the intake of water that we are taking. Thereby, we can postpone the causes of tooth decay. More importantly, while we are taking care of the regular regime or habit, it's equally important to have the usage of right tooth oral products, right? And one of them would be like toothbrush. Nowadays, when we speak about the new age technology advances, people easily get attracted with the electric toothbrushes which are available in the market, right? But it has been proven scientifically that people use electric toothbrushes, uh, they typically develop higher probability of arthritis with them. If you take the other example, which is toothpaste, right? We need to ensure that the toothpaste that we are using, right, uh, are having the right composition of fluoride, right? And I would strongly recommend that, especially for the senior citizens out there, we should use those toothpaste which are having desensitizing formulas. In today's market, you have something called Sensodyne for that matter. Though I'm not representing the brand, but I'm just giving from a easier understanding perspective, right? A different alternatives can be used for removal of floss, like you have dental stakes, water flossers are there, soft picks are there, which are more comfortable to ensure it doesn't come harms to your teeth, right? So these are the certain oral care products which probably we can incorporate on a oral hygiene practice. as we are senior citizens out there, we have to be certainly be more careful, and there are to be certain considerations we have to take, especially when we are taking care of external medications, right? uh, Dentures and implants, once we have any kind of implants on our oral, we need to ensure, without any compromise, that we undergo regular cleaning activities, and we are very, very careful when we are handling with those implants, because any kind of aberrations which may cause, it may lead to other uh, problems in your entire oral system. If you are undergoing certain amount of medications, then as I said earlier as well, it leads to dry mouth, and therefore it leads to a lot of cavity and other issues. So when you're having a lot of medications, it's very important that you undergo a small quantity of water at least every 1.5 2 hours, and you can have lot of water reminders inbuilt into your system or your phone to ensure that you don't miss on these regular practices. As it's very important that we need to undergo a regular dentist checkup as well. Strongly recommended is every once in 6 months, you should go to a dentist in person and ensure your entire oral, including oral x-rays, are carried at least biannually. And if you're not able to do biannually, then at least once in a year. And I'm sure smoking and alcohol and its uh, lopsided effect and impact on the oral as well as other organs on the body, this elite audience is already aware of. Now let's understand what are the advantages or benefits of a good dental regime if followed practically, right? It helps you in avoidance of your painful conditions, right? One of the member was just citing out that ma'am is very, very skeptical and fearful of the word called dentist, and so am I. The moment the word dentist comes, the only one synonym that we can draw is pain, which is unbearable, right? And therefore, as always said, prevention is better than cure. If you can follow those practices which we have covered in the previous slides and develop a practice of annual at least one visit or a biannual visit with your dentist, you can only prevent or postpone the dental uh, issues, right? Uh, as I said, your oral health has got a direct relation with your heart health, with the issues of diabetes, arthritis, etc., etc. Therefore, people say that if your teeth are in good shape and your oral is in your good shape and control, you have already controlled your confidence, you have already controlled your physical health by almost 30%. While food habits also constitute a bigger impact, but oral health is uncompromisable. In today's world, where we are speaking about networking, and Sukoon is also a platform for like-minded senior citizens to connect virtually on a common platform, a good oral condition also helps you to build a lot of confidence, interaction, and bring that broad smile on your face. And if you're following a regular prevention on your dental care, you're always ensuring that you are having a lesser impact when it comes to breakdown or an oral treatment is concerned. So it helps you eventually in cost saving, and also helps you to postpone or prevent your difficult health issues such as heart and diabetes and arthritis and etc. So key takeaways which I would love to bring on table is that brush regularly, floss at least every alternate days, if not on a daily basis. It's very important that you choose appropriate products. Don't get into the trap of electronic toothpaste or toothbrush, sorry for that, right? These are all fancy, but eventually it has got its own negative impacts or side effects. Most importantly, develop a habit of visiting your dentist regularly. Again, I repeat, biannual is recommended, but once in annual should be a mandatory. And most importantly, never take your dry or oral health so casually. Hydrate it regularly, because it's very important that you have right balance of saliva in your mouth. It helps you in digestion. It also helps you in reduction of cavities in your mouth. Right? In conclusion, as we speak about, good dental hygiene is crucial not in just 60 plus, but in all groups of ages. But yes, when you're senior citizens, because you have a lot of dependency on external medication, oral health becomes paramount importance to everyone. And a simple habit of brushing regularly, flossing every alternate days, visiting your dentist occasionally ensures that you improve the quality of life, and including your physical and mental health as well. Any questions so far before I get into the subsequent?
Yeah, I I think there is a question from Mr. Abhijit Das.
Yeah, Vijay sir, please sir.
Yeah, thanks, Mr. Kirti. That was a very informative presentation with very clear takeaways. I just had one question, that dental flossing has got its monotony compared to brushing. So, although
Yeah.
you have given alternatives, which was my question, are these alternatives available as the way you've written? So, do I ask for dental sticks in a pharmacy? Do I ask for water flossers in a pharmacy? And I'm missing the third one. And
So yeah, yeah.
how do we use it? I mean, does it need supervision or a visit to the dentist to understand how these have to be used, or the guidelines or the directions for use are pretty straightforward, and they do reduce the monotony with general flossing. Yeah, that was my
Okay.
question.
So flossing is available in, to my understanding and experience, flossing products are available almost in almost all branded medical outlets out there. And it typically it's very easy. There are steps mentioned on the product, right? And I would not recommend that, because it's unnecessary increase of cost, that you need to visit a dentist to understand how to carry flossing. It's as simple as that. Now, cleaning of the tooth from the soft materials which are available for to removing cavities between the tooths, because it's a new experience for anyone out there. Probably first time when you visit your dentist, you can take a expert guidance around it, and once you understand how to carry the internal cleaning of your cavities by using the softer elements out there, then perhaps you can carry on yourself. That's what I would humbly recommend out there.
I just have a quick follow-up of the three. What was the third one? For the first one was dental stick, water flossers, and the third one, you had given three alternatives.
This
Uh,
one, are you referring to?
no, the one which carried the alternatives to flossing. Yeah,
This one, right?
so soft picks.
Dental sticks are there,
So
water flossers are there,
uh,
and soft picks will be there.
yeah, so going by the name, is water flossers the most easiest way to do it?
The easiest of
Which
the
is
three.
closest to a
Easiest of the
mouthwash?
Yes, yes. It's the closest to the mouthwash, sir.
How is a dental stick different from a soft pick? By virtue of reading it, both seem to be certain pricks that you need to do to clean the in between teeth.
So dental sticks are slightly more advanced in terms of how to use it. Right, it requires certain amount of external intervention. Soft picks are slightly easier. It's like your earbuds, right? Very easily, one time you go through the instructions, you can start using on your own. Out of the three, the most easiest is water flossers.
Okay, and water flossers, if the philosophy is around mouthwash, do water flossers have any advantage over mouthwash? Because they
Uh,
have been listed as flossers, so
Yeah,
that's
yeah, yeah. So they have slightly different amount of ingredients, and yes, the element of alcohol is almost negligent over there. Therefore, for the elderly members, especially, instead of mouthwash, water flossers are the most recommended stuff.
so in sense, a water flosser can also double up as a mouthwash.
Yes,
elderly.
yes, yes.
Okay,
It's
yeah.
a double. Yes, absolutely.
And the last one, what is the cost spectrum? Which one is the most expensive, or all of them are equally priced?
Dental sticks will be the most expensive,
Okay,
followed with the soft picks, and the water flossers would be on the last.
okay. And dental sticks, these are reusable sticks, or these are like one-time
It has got
approach that you
certain
use
life.
for
It has got
diabetics?
certain life. It
Okay.
depends on the oral conditioning of the individual who
Okay.
is using.
Oh, okay. Okay. Yeah, I get that. Thanks, Mr. Kirti, for your patience and for your
No, no, my
responses.
pleasure, sir. Thank
Thank
you
you.
so much. Yeah. So what we have also done is that if there are questions, I would also once again take up. But I'll just give you a brief about what we are building in Zappy Care and how we can help you also in that particular process. So Zappy Care, as you all know, and I'm sure you already have a health insurance policy, right? So in India, when you buy a health insurance policy, you pay a premium and you cover your hospitalization expenses, right? But traditionally what happens is that you also need certain financial protection plans to cover your everyday health expenses, and we are speaking about dental expenses in today's topic. So at Zappy, we are India's first and the largest OPD healthcare expense management platform. Now, what does it mean? It means we help millions of people out there to subscribe to a plan and manage their everyday health expenses. And we are in partnership with UPI, which is NPCI. What does it mean for you and me? It means for you and me is that you pay a small amount of premium and you get a cover for your everyday health expenses. Now, what are these everyday health expenses? These everyday health expenses are your doctor fees, your medical fees, your dental fees, your vision care, your physiotherapy, etc., etc. Now, these expenses are not covered by your traditional health insurance policies. So therefore, health insurance policies only comes to safeguard in the event of hospitalization. And that too, those hospitalization which are covered into the insurance policy. And I'm sorry, most of the health insurance policy does not cover senior citizens out there. And even if they cover, the premium is so high that it becomes non-affordable, right? So what Zappy does today, as I speak to, we have over 1.5 million customers pan India, and we work and give special plans and programs in collaboration with large insurance companies, and we give these plans to our customers. One such plan, which our product team has built, is India's first standalone oral care plan. And since this topic is around dental care, and especially for the seniors out there, I thought this product would make much more relevance to everyone.
I just want
Fisher
to give
sealant.
that information because it's not well
Okay.
known in
Yes,
as
ma'am.
far as I know.
Yes, ma'am. It is not well known. Not, hardly dentists also will not know this in India. Many dentists.
45 years ago, I had it done for my daughters, and they
Oh,
are cavity free today. One is 50
wow.
years old, the other one is 47. Both of them are cavity free.
Superb. That's called preventive maintenance.
Yes.
Wonderful.
I just had a
So,
quickie there. This Fisher
sir, any
sealant is
idea?
what?
Sir, any idea? Clove offers this Fisher
Uh,
sealant.
I have to check up, sir. I have no. I don't believe
Good
in
information,
false.
madam. Thank you. I will ask my daughters to get it done.
Yes, please, for all of you who have grandchildren, please get it done.
Let me just check right now when I'm speaking with ma'am. 1 second. Whether
No,
they offer or not.
is this a film on healthy teeth itself, so that
Yes.
the substrate itself becomes unwelcome, becomes a non-breeding ground for cavities? Is it like that? So, for
No,
example, if I
what they do is etch the top of the crown, you know, where all the fissures are. That's where food gets stuck, and that's how cavities form. So they slip in a plastic, I don't know, some material that slips into these fissures and seals them off. That's why it's called fissure sealant.
Okay, so the tooth becomes totally unwelcome for bacteria in case you miss
Yes,
out on
it
brushing or become a little careless with brushing.
because
Even
children are careless. They're not
yeah,
brushing
yeah. Even
well,
I just wanted to understand the philosophy now.
and they
Because
eat a
I
lot
was
of
discussing with my
sweets.
dentist and she told me very clearly there isn't anything of this in India at all. But she didn't know it at all.
She
So
probably didn't know.
because I was telling her that at this age I want the substrate itself to become unwelcome for bacteria.
I know how
So
bad my teeth are, and that's why I was so careful with my daughters.
So, ma'am, just
Thank-
to tell
Thanks a
on
lot,
the
madam. Good information.
just ma'am, just to give you one more information, that treatment Clove is offering. Sir, you were asking me.
Wonderful.
There you are.
Wonderful.
So I just confirmed with them.
Maya, can you spell it out, please? This treatment, can you spell it out?
Fisher. Fisher.
Okay.
Fissure. Fisher.
Sealant.
Sealant. Sealent. Well, Lent.
Got it. Thank you.
You're most welcome.
So then there is a question from Mr. Raghavan sir, but it has been answered, I think, by Ganesh. So you can verify, sir, is it okay? Water flossers, any make. So I think Mr. Ganesh has answered Ora Cura. I don't know. I have no idea.
I was about to say the same.
Okay.
the Fisher sealant, is it immune to erosion? For example, does it get eroded while brushing?
No.
No, sir, it doesn't get eroded. Yeah,
So,
ma'am, correct.
so
are
you
right.
don't need to go into maintenance drives for this Fisher sealant.
No.
It's
So
a
once it
one-time action.
slips, once it slips into the fissures, that part doesn't get worn out. It's just
Okay.
what is extra around the crown of the tooth. That's the one that gets worn off. But that doesn't cause decay. It's the fissures themselves that cause the decay.
Yes. Yeah, thanks, Maya ma'am.
You're most welcome.
Raghavan ji has one question, sir. Could you ask, does it work for cap? I don't know what it means.
The plan you are referring to, sir, Raghavan, sir?
Okay. So it works?
Yeah. There is no restrictions at all for the plan which I showed you.
Okay. So with that, chat box questions are over. Anyone having any further question is welcome to ask. If no, maybe we come to the end of the session. So in the chat box,
I have got a question.
please, sir.
Some people prescribe apple cider, to take it early in the morning. Does it affect your teeth and gums?
Sir, sorry, I had no idea about that.
Okay. No, it is basically used by diabetic patients, so that's what I'm asking.
I respect, but I have no idea about that. So sorry for that.
No, thank you.
Good evening. Good evening and thank you. Thanks.
Thank you
everybody.
very much.
Thank you
Bye-bye.
very much.
Respect you very much. Bye.
Have a good day.
Thank you so much. Bye.